Now, thanks to the leadership of all four caucuses, the General Assembly has made significant progress over the last 3 years in making the legislative branch more transparent. Legislative committees are now subject to open meeting requirements. Last year, our budget was completed and posted online well before June 30th. Now, transparency also needs to extend to the way that lobbyists do business here at Legislative Hall, which is why my administration will team up with President Pro Tem DeLuca and Speaker Gilligan, Majority Leaders Blevins and Schwarzkopf, to propose some common sense measures that we hope you'll support. You know, citizens deserve to know who is lobbying and what they're lobbying for. And we will make it so with the new online reporting tool where citizens can see by piece of legislation which lobbyists are advocating for their clients. And we've been successful in pulling together in tough times, in no small part because of faith in the responsiveness of Delaware government. The trust of people in their state government should not be undermined by a perception that lobbyists have hidden access here in Dover. Now, governing responsibly means governing efficiently and working closely with the Joint Finance Committee under the leadership of Representative Williams and Senator McDowell. We've eliminated more than 1,000 positions in the executive branch. We slashed our vehicle fleet. We renegotiated our leased space to save millions. We stopped unnecessary printing. Last year, we confronted the unsustainable long-term costs associated with our state employee pension and health plans. You know, the prospect of these looming costs gave rise to shrill rhetoric and pitched battles in other states. But here, we work together. My administration, representatives from both parties in both chambers, the leadership of major public employee and public education unions. And we achieved results, a package of reforms that will save the taxpayers more than $480 million over the next 15 years. Now, our search for greater efficiency continues with an extensive examination of the criminal justice system. And under the leadership of Lieutenant Governor Dehn and with the participation of Attorney General Biden and law enforcement and the judiciary, we're conducting a thorough review to figure out how we can get the most for the taxpayer dollars that we spend on public safety. We look forward to receiving the recommendations of the Justice Reinvestment Initiative Task Force later this spring, and to working with you to implement those reforms that can have the most positive impact. You know, there's one cost driver that looms above all others and will swamp all of the savings we achieve elsewhere if not addressed. It's the cost of health care. Last year, we increased spending on Medicaid by $56 million. My budget will recommend an additional $21.7 million increase for next year. Over the last 10 years, this program alone has grown 127% to the point where federal and state spending together exceed $1.2 billion each year. The total commitment of taxpayer dollars on health care is staggering. Yet the expectation is that year after year we'll continue to pay more for health care, whether we receive quality results or not. The incentives that we have in place in our health care system reward neither efficiency nor quality. These incentives encourage more services and tests, not better results. We've got a system that doesn't encourage healthy behavior in patients and doesn't discourage unhealthy behavior. In essence, we don't have a health care system. We have a sick care system. Now, you know, we're not going to solve the national health care debate here in Dover. But we can reduce our costs, and we can improve quality by focusing on how the state procures health care. The idea may sound far-fetched, but we've quietly been making progress. For example, we know that seniors requiring long-term care often prefer to stay in their homes, and that so long as they get the care at home that they need, the results are often better and less costly. And starting April 1st, we will replace our traditional reliance on institutional care for seniors with a strong emphasis on community living. This will improve care and save money, and I want to thank Secretary Landgraf and her staff for making progress on this very important issue. Our Housing Authority, our Department of Health and Social Services, our Kids Department are using the same approach to improve the quality and reduce the cost of the care that we provide to those who have traditionally been cared for in our state hospital, and to young people aging out of foster care. Young people like Mindy and Matt Stevenson and Nicole Byers and they join us here today because when it comes to issues affecting the teenagers who age out of foster care, we will make no decisions about them without them. So these three agencies are partnering to provide housing and the supportive wraparound social services so these individuals can achieve independence, and we will propose to expand this initiative. Now, the use of technology in healthcare is critical to improve quality and reduce costs. When you go to the doctor or the hospital in Delaware today, you may find your doctor can access recent lab work and pathology reports instantaneously. And soon your doctor may be able to pull up your prescriptions and x-rays and MRIs. And this allows your doctor to make quicker and better medical judgments, and it makes it less likely that your doctor will order unnecessary tests. And this use of information technology to provide better, less costly care is increasingly a reality. Now, a next step to leverage technology is to create a claims and cost database. Business leaders have come to understand that the key to improving performance is harnessing the capacity of information technology to aggregate and then analyze data. And this database will allow us to figure out why some providers get better results and why some providers create more costs without better results to show for it. We'll be in a position to reward what works and to change what doesn't. And while this innovative technology is important, Delaware's biggest purchaser of health care, the state, needs to insist on incentives for providers that are aligned to improve quality and discourage waste. Taken together, our Medicaid population and our state employees and retirees represent nearly 40% of the health insurance market here, accounting for a total of $1.7 billion of taxpayer expenditures. We look forward to working with the provider community to get these incentives right, because the incentives at work today are the wrong ones. And we're pleased that the Delaware Medical Society and the Delaware Healthcare Association are already active on this issue and have agreed to work with us. Now, providers are not the only ones who have roles to play here. Moving from a sick care system to a health care system requires the people that we insure to take responsibility for making healthy choices. We need to encourage them in these choices for their own sake and for the sake of all of us who end up absorbing higher health care costs in the form of higher premiums and higher taxes. About 2 years ago, I created the Governor's Council on Health Promotion and Disease Prevention. They have done some terrific work, as has the Sussex Outdoors Initiative. And some of our institutions of higher education are also working to provide an incentive to their employees to take better care of themselves. We will build on much of this work. And within state government, it's time to make all of our campuses in their entirety smoke-free. Otherwise, we are facilitating behavior that's not only harmful to those who engage in it, but that we know with certainty will heavily burden future generations of taxpayers. Turning around this cost curve will not be easy, and it will take time, but it's work to which we must commit urgently and earnestly if we are to put ourselves on a sustainable financial course and retain the freedom that we all want to invest in our children and in our future. This is Delaware's time to lead. Creating more and better jobs, improving our quality of life, providing the best schools and learning opportunities for our children, getting the most out of each tax dollar, strengthening the trust of our people in their government. These are challenges even in ordinary times. We don't live in ordinary times. Change and challenge accompany us each day. Allen's Family Foods is no longer selling chickens across our region. Now it's part of Harim, selling Delaware poultry into Korea and across Asia. On the former Chrysler site, Delawareans will be building Bloom Energy servers to provide clean energy where they once built SUVs and tanks. We can shrink from these challenges, or we can do as a business destined for industry leadership would do, and see in this moment an opportunity to change the game in our favor. The economic ground is shifting under everyone's feet. Others are finding it difficult to adapt. They're pointing fingers rather than pulling together. They're holding each other back rather than lifting each other up. Our history and our culture demonstrate that we do better than that in Delaware. But to take advantage of this moment and build a lasting competitive edge for our state and its people, we've got to do more than simply work with rather than against each other. Together, we must act with confidence and imagination. We can't settle for an economy that's dependent upon a handful of major employers. We'll nurture an environment where startups and small businesses can experiment and thrive. We can't settle for schools that are just better funded versions of the schools that we remember from 20 years ago. We'll help the schools that will prepare our children for the jobs 20 years from now. We can't settle for the sick care system we inherited from our parents. We'll create a health care system that pays for performance and delivers quality care at a price that families and taxpayers can afford. I thank each of you, the people of Delaware, and the state employees who serve them, for your support over these past 3 difficult years. Working together, we have kept Delaware moving forward, and now it's time that we forge ahead. With our own hard work as elected leaders, guided by sound judgment and God's blessings, we can secure a better future for our citizens. We can win in the turns. This is our time to look ahead, to leap ahead, to lead. Thank you.